Great, I think we can go ahead and get started, and as more people join, they can enter while we're kicking things off. My name is Mark Mormons. I'm with the Arizona Commerce Authority. Proud to be presenting today's afternoon session of our Arizona Small Business Bootcamp and Resource Collective. For those of you that have participated already, you know that we couldn't do this without our community partners, many of whom are listed on this page, but there's a lot more that we'd like to thank and give credit to because this is really a group statewide initiative and effort that we're really proud of. The Arizona Small Business Bootcamp, we're in week 3 so far, and it's designed to help small businesses, 20 employees or less, navigate the COVID crisis and prepare to return stronger. Obviously, everyone is encouraged. If you or businesses you know have more than 20 employees, they're welcome to attend as well. Just want to make sure the content is relevant for all the people on the line. Like I said, it's a statewide initiative put on in partnership with community partners across the state, 2 of whom you'll be hearing from this afternoon. And we are excited to announce we're in week 3 of the boot camp, and we have 6 weeks here on this page, but we're going to be going through June at least with this content. We've gotten such positive feedback and have been able to touch over 1,000 small business owners that we want to continue this momentum and continue to bring great content to each of you. So this week was another great topic week. We started the week with what to do after you received your PPP loan, so talking about tracking, organization, and forgiveness. On Tuesday, we had a discussion on how to manage your employees during the crisis. Wednesday, we had a restaurant-specific session with our partners at AZ Local First. And today, we have how to return to work safely. We had a morning session, and this session presented by our partners at the Arizona National Safety Council. Tomorrow, we're going to be having a panel of experts talking about marketing and how to market to return stronger. So it'll be a broad topic, ask the expert. Encourage you to register for that. An email should go out this afternoon with next week's topics where you can register for those as well. We've got another great week of content lined up, so I encourage you to attend. I want to hand it over to my colleague, Robert Theobald, to present on some of the updates for PPP.
Hey, good afternoon, everybody. So PPP funding as of yesterday afternoon, May 13th, was still at $117 billion in the pool. So if you're in that process, follow up with your bank. If you haven't heard from your bank in a while, definitely follow up with them. There are other lenders that are able to process this fairly fast, and the funds are there still, so take advantage of that. For those that didn't hear yesterday, the PPP round 1 and 2 funding has been able to impact and help 70,000 plus Arizona small businesses with over $8 billion in loans. Putting us in the top 16 for a number of different categories related to these loans. Also, the EIDL advance, the numbers aren't that new. We're still working off of the numbers they shared a few weeks ago, but through the EIDL advance, 52,000 plus businesses in Arizona have received a portion of that. So those funds are going out for the advance, totaling over 176 million. Key dates that have already passed and allowed some businesses to get back open. Barbers and salons opened last Friday if they chose to. Restaurants were able to open on Monday if they chose to. And then yesterday, pools, gyms, fitness providers, and spas were able to open following the social distancing guidelines and the CDC guidelines. So some great news. Things are starting to open up again. And so those are the updates.
Thanks, Robert. In addition to updates on PPP and EIDL, we're working in conjunction with a lot of partners to bring you kind of an aggregated resource list of everything that's out there. So we encourage you to go to the AZ Commerce website, azcommerce.com. We've got a specific COVID-19 resources page right on the home page. And you can also visit our partners at the SBDC website for resources on supporting small businesses. We've got information on building out your workforce and also support for manufacturing in the state. There's also the Arizona Together website. It's arizonatogether.org. This is the governor's website, which compiles a lot of the resources that have come up across the state, guides, info centers, FAQs, and directories for how you can find additional support. Finally, we've been compiling a lot of the information that's out there to support small businesses. This is just a small handful of some of those industry-specific resource guides that we've found. This is a small business bootcamp and resource collective. So on our website, we're going to be posting all of these resources in addition to other information from our partners to help you kind of navigate this crisis. I will post the link to that in the chat box in just a minute. But we want you to stay informed. So Arizona, azcommerce.com is the place to go /COVID-19. So today, like I mentioned, we've got great speakers from the National Safety Council, the Arizona chapter. We've got Amber Pappas and Ed Taubey. Ed did a great job on this morning's call, and a really important content for all of us as we think about reopening safely, both for ourselves, our employees, and our customers. So without further ado, I will hand it over to our speakers for today. If you do have questions, we'll have plenty of time after their presentation for Q&A. We ask that you use the Q&A tool at the bottom of your screen or the chat box. We'll be monitoring both. And then Robert and I will be posting some links in the chat to help you navigate to some additional resources. So Ed, if you want to go ahead and share your screen.
All right, sounds good. Thank you. All right, so we should be seeing my COVID-19 back to work first slide. So we should be good there. I want to thank everybody for joining us this afternoon. We're coming live from the Arizona Chapter National Safety Council. My name is Ed Taubey. I'm one of the safety trainers here. And we offer a lot of safety support and safety training courses for businesses, for individuals to help you be safe on the roadway, at work, at home, and at play. Specifically here, we offer first aid CPR courses, various defensive driving courses, construction zone flagger, lift truck, and advanced safety certificate courses that are more geared toward the safety manager, safety professional. Joining me today is Amber Pappas from Safety Help Today. Amber, good afternoon.
Thank you, Ed. Thanks for having me here. It's a pleasure. I will be speaking a little bit later on some of the OSHA requirements and a lot of the questions that we've been receiving when it comes to what you need to know in developing your return to work programs. But I have the pleasure of working with Ed. I'm a trainer here at the Arizona chapter of National Safety Council and also the president of Safety Help Today. We work with employers of all sizes and all different types of industries, assisting with OSHA compliance, consultation, safety training, and developing plans and programs. So again, thank you for having me here.
You're very welcome, Amber. I'm glad you're here this afternoon. Did okay this morning, but you're the brains of this operation, so I'm glad you're joining us.
I appreciate that.
Let's start off with a few goals for today. We want to provide you some information about the current COVID-19 pandemic, and then provide assistance to you as your workplaces reopen and your employees are returning back to work. We're going to talk about some of the effects that this has had on your businesses. And you know better than we do what kind of effects are out there, but we're going to also help you determine what your exposure potentials are and give you some guidance on workplace controls that you can implement that's going to help keep people safe. So I want to start off by saying, let's cut through the noise. And by that, there's a ton of information out there in the news media, social media, your neighbors, a lot of people. There's a lot of different opinions and a lot of theories about what's happening right now. We want to focus on the facts, and we want to focus on reliable, solid information from the CDC, from World Health Organization, from the State Department of Health Services, the Governor's Office, and National Safety Council. And we're going to take those facts and work them in to help people, like I say, just cut through some of the background noise that we know is out there. Some of the effects on the workplaces from an operational side, you've experienced either total or partial shutdowns. Some businesses may not reopen at this point. There's permanent closures, resulting obviously loss of revenue, loss of productivity, changes in the commerce patterns, a backlog in the goods and services that you would normally be providing, and certainly interruption in the supply chains. You know, we all know what happened to toilet paper and paper towels and sanitary wipes when this thing first, we couldn't get any. Those supply chains are being restored and things are definitely improving there, but there could be other supply chains that are going to have some issues moving forward. Workforce factors, a reduction in hours, total unemployment, increased absenteeism in the workplace. And then there's just a lot of stress and fear and anxiety around, what this is going to be like moving forward. How do we adapt to it? There's fear because we don't know enough about the disease itself. There's no vaccines yet. So, and when people are coming back to work after being home for an extended period, it's going to be an adjustment back for them. So we're going to try to give you some tools and some techniques that are going to help reduce the stress and the fear in your employees. We do have a quick poll, and we'll launch this. Let's go to poll number 1, sorry. And if you could just click which of these applies most to your business. Did you have a total closure, some restructured operations with very limited customer interaction? Maybe you're open to customers, but you had to adjust your hours or limit your capacity. Or were you considered essential and had some nearly full operations, even though you may have had some people working remotely, your overall operations kind of continued. So we're about halfway there. So we'll give you about 10 or 15 more seconds, and then we will end the poll and kind of look at the results. We're getting close. Let's do about another 10 seconds and we'll call it good. We appreciate everybody participating in this. And I'm going to go ahead and end it. There we go. So here's the results. About 20% of you were a total closure. We had some that were restructured with limited customer interaction, but the larger majority were considered essential, and you had some nearly full operations. So that's an adjustment in itself, is how do you maintain your operations yet keep everybody's distance and safe and those kind of things. So thank you for that. That's helpful information for us. And we do have another poll here that we'll share in a few minutes. So. All right, moving forward, let's talk a little bit about the disease and the virus. And some of this information has been out there for a while, but it's important to have the foundation of where we're starting with. So the COVID-19 moniker is actually, CO stands for coronavirus, for corona, VI stands for virus, and D stands for disease. And it appeared in 2019, so that's where the 19 came from. So that is the name of the disease. The actual name of the virus is the SARS-CoV-2, and SARS stands for Sudden Acute Respiratory Syndrome, and CoV stands for coronavirus, and this is the second time it's happened. You may recall there was a SARS outbreak a number of years ago, and it was also in the coronavirus family, and that was actually SARS-CoV-1. They just didn't name it 1 because they didn't know there would be a 2. So this one is CoV-2. Symptoms we originally focused on were persistent cough, shortness of breath, and fever. Last week, CDC added more to this list. So in addition, we're looking for chills, shaking with chills, muscle pain, headache, sore throat, and new losses of sense of taste and smell. So the list of symptoms that we want to observe has expanded recently. So how is it spread? The primary source is large respiratory droplets. You see in the photo of the man sneezing, the larger droplets are already on a downward trajectory. They're the effects of gravity. And studies have shown that those will fall in less than about a 6-foot area. And that's where the 6-foot social distancing standard came from. But when you look at the secondary sources of prolonged contact with aerosols and contaminated surface, what happens there is the areas of our eyes, nose, and mouth are the sources of entryway, those mucous membranes in those areas. And so if we touch a contaminated surface and then rub our eyes, rub our nose, touch our mouth, that's how it's then introduced into the body. And so that's why they're telling you, wash your hands frequently, wash surfaces, keep everything as clean as possible, and don't touch your face. And that's really hard to do. I never realized how much I touched my face until I wasn't allowed to do it anymore. And then the aerosols, you see in the picture, the really fine mist that's going out from that sneeze are actually aerosols. And those aerosols will remain in air for about 3 hours. So it's that prolonged contact with aerosols, and where this is really a factor is in healthcare, where the caregivers are in very close proximity to the patients, and they're in closed spaces, and there's a lot more aerosols that are airborne. And so they're getting this constant prolonged contact with the aerosols. But because the droplets are so much finer, it takes more of them to introduce the disease. So it's active, like I said, it's about 3 hours in aerosol form, 4 hours on copper, about 24 hours on cardboard, and 2 to 3 days on plastic or stainless steel. So that's a long time to be concerned. So that's why we want to clean those surfaces, right? So thinking beyond COVID-19, we're focused on that today, but moving forward, there's other diseases that are going to come up. This isn't the first time this has happened, and it's not the last time. So look at what your current industrial hygiene protocols are, and let's build on those and make sure that those are updated to the current pandemic. Use that experience we've had in other outbreaks and modify those and bring them up to date. And then what are you going to do in the future? At some point, this one's going to, it's never going to go away completely, but it's going to subside to the point where we have some vaccines, and it's going to be similar to a flu kind of thing, where it's still going to be there and there's going to be some outbreaks, but it's not nearly to the level we have now. So you do have to make some plans for moving forward, and we'll go into that a little deeper later on. So I'm going to turn it over to my friend Amber here, because she is our OSHA expert. So OSHA, Amber, take it away, please.
Thank you, Ed. So before I get into general recommendations, Ed a little bit later is going to talk about some specific recommendations when developing your return to work programs and what that looks like. I wanted to start with some foundations. Ed spoke a little bit earlier about the noise. I love that he included that. I've recently begun to get a flood of phone calls of, Amber, I've heard this. I've heard that OSHA, OSHA's enforcing and citing employers for not mandating, the N95. There's a lot of noise out there. And so I want to focus on what OSHA is saying. I want to cut through the noise of what, again, OSHA is not and what they are. So when it comes to the requirements for employers and what OSHA is saying, there is no specific regulation for COVID-19. The OSHA does have standards on PPE. They've got the respiratory protection programs, standards on other bloodborne pathogens. But when it comes to what we're facing right now with this disease, we want to look to the general duty clause. So I wanted to include it first before we move on. If you look at section A1 of the general duty clause, you're going to see that OSHA requires each employer to furnish to each of his employees employment and a place of employment which are free from recognized hazards that are likely to cause death or serious physical harm. And so what does that mean? Employers have a duty to assess for exposures that have the potential to cause that injury or harm. But what I want to point out is it's safety and health. I've got a lot of phone calls of, Amber, this doesn't really necessarily, tie into OSHA. Yes, it does. And as Ed mentioned, it ties into that industrial hygiene. Employers have a duty to protect worker health. And so that's where OSHA is coming from. This is kind of your catch-all. It doesn't necessarily tell us what to do, where to go, and how to, but it states, employers, you have to. So one way that a good way that an employer can meet these requirements is to perform a hazard analysis. Take a look at your operations, identify potential safety and health hazards. You want to look at the associated risks, and then we want to implement effective controls based on that. And again, I want to point out how it's important that you as the employer have to determine the risk at your place of employment. While OSHA, NIOSH, the CDC, they've got a lot of good recommendations. However, the duty falls back onto you to determine what are we exposed to, what are we going to implement. And then again, in the next few slides, I'm going to give you some recommendations on that hierarchy and what we can do to put those controls in place. Before we go to the next slide, I want to point out section E of the general duty clause specifically talks towards the employee. Employees also have an obligation to comply with the OSHA, all standards, the rules, regulations, and then anything that you, the employer, put in place. So that's an important factor because we want to get the employees involved, which leads me to my next slide. That's quite all right. Thank you, Ed. So where do we start with all of this, right? We've got, again, a flood of information, a lot of good resources, but when I work with certain companies, it's Amber, maybe I have a program, maybe I don't even know where to start and what to do. So I like that they've thrown in their first thing, start with sanitizing. Obviously, that's one good thing that we could put in place, but I'm gonna recommend, most of you in the poll mentioned you were considered essential, so you've already kind of been working, but let's get a team together. And the reason that I put that, when you're figuring whether you have a program and you're going back and kind of updating and reassessing it, or you're starting from scratch, it's important that when you're analyzing and looking for those potential exposures, that you're looking at what I call the 3 E's. You're assessing everything, everyone, and everywhere. And when this is assigned to one person, I've often found when I come in to do maybe an audit of a program or something, when one person's handling it, there often tends to be a gap. Maybe they're coming from their department and their perspective, so they don't necessarily see things. So I encourage you, develop a task force, get a team together, get employees involved as well. Ed talked a little bit about that fear. One way that we as employers can do that is to let them know what we're doing, allow them to be a part of this, and you'll find oftentimes those frontline workers, they're going to see things differently from maybe a management perspective. So start with the team. Again, you want to assess for your exposures, look at the specifics of your business, go back to those 3 E's. You can refer to OSHA's risk pyramid. There's a good document that's out there, but we want to start, if you don't already have everything written, you want to look into developing an infectious disease preparedness and response plan, maybe an emergency action plan. You want to take a look at, again, where are we exposed? You want to develop certain things, what to do, what are our responses going to be if we have primary versus secondary exposure. Before we take this poll, I kind of want to get a feel for those of you that already have programs, or maybe not, but there's some good foundations to start it. Those of you that have a bloodborne pathogen program already written, take a look at that. Don't reinvent the wheel. Again, Ed mentioned a little bit about previous exposures, or maybe you've dealt with other different diseases. Pull from that, and then we'll work together as a team to update it. So we're going to go ahead. I'm going to hand it over to Ed. We want to see where everybody's at as far as with having a current plan.
It helps if I unmute. Second poll is, prior to the pandemic, did your company have a written emergency preparedness plan in place? So we have 4 choices. Yes, and you had one that included potential infectious disease planning. Yes, but it did not include infectious disease. Number 3, you had a good intention and knew you had to do it, but just haven't gotten around to it. Or number 4, some people don't even know they need one. By the way, this is an OSHA requirement. So let's take a look at this and see how we're doing. We got about half of us that have voted. By the way, this is anonymous. We can't tell who's saying what, so be brutally honest. And if you have some gaps here, this is a good time to think about that and consider, after this presentation is over, what your next step might be. And it could be to help create a plan, right? Let's go about another 10 seconds here, and then we'll close this one out. We've got about 19 out of 26 of us, so we're good there. So I'm going to go ahead and close it, and we're going to share the results here. So most of us do have a plan. About a third of us have a plan, but it doesn't include specific infection disease control. And that's not unusual. Most of us don't think about that when we create these plans. But there's, when you combine no plan and didn't know you needed one, we're about 47%. So that's something that is a good thing to look at within your business and see if you can't find a way to remedy that. All right, very good. And so we'll go back to our slide here, close this out, and we should be able to advance and back to Amber.
All right, so thank you again for participating in that poll. Whether you've had a plan, I applaud those that have already included the disease prevention plans. That's great. Again, some of you that have them don't. Regardless of where you're starting from, you want to start with some general precautions. Some of you might already have included this, but take a look at some things like, what are your stay-at-home policies? If you've got stay-at-home policies in place, whether it's staggered shift or you've got workforce, some that are working from home, you want to take a look at what are the procedures for that. What are you going to do when they are at home? What are you going to do when they return back to work? Whether they're returning back and they possibly, you know, they've been with a community, what exposures have they faced during that? So you've got to take a look at that. Again, social distancing, the respiratory etiquette, and then we'll talk a little bit later on the administrative controls and how to implement some of that stuff. Continuing hygiene and sanitizing, that's huge. And then PPE, which we'll spend a little bit more information, a little bit more time, because I want to go specifically into PPE. So let's skip to one of my favorite slides in this one is the, let's see, hierarchy of controls. So a lot of safety and health professionals, we love this. Some of you, this might be new to. I've actually got quite a lot of feedback of, Amber, I had no idea. I've never seen this. I didn't know OSHA even, you know, encouraged this. So we safety professionals, we love this. So this is considered, we call this, OSHA calls it the hierarchy of controls. It's a framework, and basically put, the best way to control a hazard is to systematically remove or reduce the exposure rather than relying on human behavior to do so. So it's a framework, it's a system of controls that we can use to help us with your plans and your programs. Oftentimes I see, again, if it's an audit or something, employers, you know, we're trying, Amber, we've done this, we go right to PPE. Well, I want to point out with this upside down triangle, if you take a look along the left side of the triangle, you're going to see that arrow. When you start at the top, you've got more effective controls. Elimination, simply put, if we can get rid of the hazard, we're not exposing anybody. So it makes sense that that's the most effective type of control. And when we can't use elimination, then we're going to go down. As an employer, we're going to do our assessment. We're going to see where our potential is, the risk, and then can we substitute things out? If we can't, we'll go all the way down. But what I want to point out is, where is PPE on this upside down triangle? It's at the bottom. PPE is less effective and it is your last resort. And what I want to point that out, when we put our programs together, and we jump right to PPE. I see a lot of it. Well, Amber, we're just requiring our employees to wear the N95s or the face coverings. Well, what happens when that fails? What happens when you don't have it? OSHA's actually put out some information recently on their COVID-19 plan about encouraging employers, go back, whether if you've already got a program written, go back and look at it and see where you can implement engineering and administrative controls so that you're not necessarily requiring on this PPE that we're already having a hard time getting access to. So I wanted to point that out. I'll talk a little bit more specifically, but the rest of today's presentation, when we're giving you examples of certain controls, specifically, Ed will talk a little bit more about your industries. Use this chart, take a picture of it, Google it, do whatever you have to do, but in your programs, start at the top and then work your way down. Sometimes a lot of, you might be in a situation where you have to use multiple. Maybe you'll use an engineering control in a workplace practice and then PPE on top of it. But I want to point out that there's a strategy when it comes to selecting what we're going to do. All right, so you've noticed that I skipped elimination and substitution. While elimination and substitution are more effective controls, we can't always implement them, and with time being kind of limited today, I wanted to jump right to a lot that I do think most of you guys will be implementing into your program. So engineering controls, again, we saw that in the more higher in the towards the triangle, but an engineering control involves isolating employees away from work-related hazards. These types of controls reduce exposures without relying on the worker behavior. So you'll notice if we install a physical barrier like you've seen in the picture, I'm not relying on my employees to do anything. That's why these tend to be more effective than, again, just jumping right to PPE. Maybe you might take a look at increased ventilation. It can include installing local exhaust ventilation. Maybe you've got general dilution. Some employers may choose to install high efficiency air filters. So again, you want to take a look at what your options are. Maybe you're going to reconfigure your workspaces or your production lines like we're already starting to see. Adding and installing touch-free restrooms, faucets, towel dispensers, paper towels, or excuse me, trash cans, whatever that might be. Again, the whole idea here is putting in some type of control to help. Again, we're not eliminating the hazard, but we're engineering out that hazard. We're not relying on our workforce to do anything, and that's why they tend to be more effective. If we go to the next slide, we're going to see administrative controls. So when we can't institute engineering controls, maybe, you know, logistically, it's just not going to work, or we can't get access to certain, you know, physical barriers, they're on backlog, we're going to take a look at administrative controls. And so administrative controls, they do require action by the employee or the employer, but they often include changes in the work, how we do things. So maybe we're going to work remotely, right? Or we're going to have a staggered hours. Again, take a look at that. Can you logistically do it? Can you ensure that the workers are still safe? Do you have procedures in place for those that have staggered hours, break times, that type of stuff? If they're going to work remotely, if they have to show back up to the workplace, what is that going to look like? Safe work practices, that's things like, you know, do you have an injury response program? Do your employees know if I'm injured, if I get an illness, where to go, who to talk to? If I get this a lot. I've got a lot of phone calls of, Amber, I got a phone call from an employee whose sister had, you know, COVID-19, and they may have come in contact, they may have not. Already have this in place. What are you going to do when it's a primary exposure versus a secondary exposure? Because there's different things that we can do. What does that look like? Are they going to self-quarantine? Are you going to send them away for testing? So again, going back to that fear and that stress, in order for these programs to be effective, they have to be practical, and we already have to think this stuff through. We want to give our employees these resources of, look, we've got this, we've got these procedures in place. Before you come to work, you're going to ask yourself these questions. So think those things through. Travel policies, right? We want to take a look at whether non-essential travel versus essential travel. Are you paying attention to the CDC travel recommendations? Again, in administrative controls, this is where we see disinfecting and hygiene. As Ed talked earlier about how it's spread, OSHA does consider that primary source of contact, you know, those droplets. So what are we doing? Are we heightening up sanitizing? Are we talking to employees, giving them the option to disinfect their work areas? When we do that, are we going to put up signage? We've got to remind our workforce of, hey, stop the spreads of germs. These are good ways. Visual cues are a good control, again, to remind the workers of, this is our program and this is what we're doing. But the key with this, I want to spend just one more second on education and training. This is huge. Oftentimes I'll find employers will put these elaborate programs together, really well written, really well thought out, but then we don't pass it along. We're not educating our workforce. What does it mean? Amber, when you say hygiene practice, what does that mean? We can't automatically assume that everybody understands. So we've got to use that as a control. Let's educate everybody. Let's train them on what the difference is between primary exposure versus secondary exposure. Let's talk to them about good disinfecting, what that means. We talk again that respiratory etiquette. So make sure if you're going to use these administrative controls, you also want to include procedures for how you're going to effectively, train your workforce. All right, PPE, another fun one. So PPE, as I explained in that hierarchy of controls, this is your last line of defense. So obviously we're not going to run right to implementing, hey, this is our return to work program and everybody's got to wear face coverings. Again, if you go to OSHA's website, you'll see why they do recommend some of this stuff. They're asking you, take a look at other engineering and administrative controls first and use this as your last line of defense. Because let's be honest, some of this PPE is not even available. So why write a program dependent on stuff that's not, not easily, readily available to our workforce? So last line of defense, and PPE can include things like glasses, gloves, gowns, face coverings, but you have to be careful. I was with OSHA yesterday, and there was a question that came up of, hey, are we required to wear this? Do we have to? They're not going to answer that. They go right back to you as the employer. Have you done your hazard assessment? Have you determined where your potential exposures are? And then have you gone through and implemented a program that uses all of the different options available? So when we throw in PPE, you want to consider some things. You want to consider logistics. Can you get it? OSHA, again, they just put another memo out, I believe on April 10th, talking about what to do if you can't access certain, if you're in an industry that requires the uses of the N95s. They've given you some good information on what to do when you don't have access to that. But regardless of what you decide to select, make sure if you're going to choose some form of PPE, look at the regulations that are tied to it, because there might be some additional requirements. I'm going to go right back to that N95. If you put in place a program that says, hey, look, we've got all of this in place, but you have to wear, you the employee, we are requiring you to wear the N95, you now have to have a written respiratory protection program. OSHA is still, they haven't eased up on that at all. There's a little bit of consideration, but bottom line, you still have to have a written protection program. You also have to fit test your workers before putting this N95 on. You've got to make sure that they have a medical evaluation so that they're medically capable. So you look to see what other regulations are tied to certain PPE. We're in Arizona. Heat stress is huge. Again, we've got we have workers that can't wear certain coverings because of asthma, because of other health related issues. So I just want to point out, choose something that's going to be effective. Don't just jump right to PPE. Take a look at all of your available options. And then if you do determine you're going to still institute certain PPE, make sure you're training your workforce. Train them on how to properly fit it, how to don it, how to use it, how to care for it, and how to dispose of it. All right, so I'm going to hand it back over to Ed. I've given you guys some general recommendations when putting your programs together, some certain controls to look at, but Ed's going to address specifics regarding to the industries.
Thanks, Amber. Great job with that. Yeah, we've broken down into 5 general categories, and we realize not everybody's businesses are going to fit neatly into one category or the other. But this is just to give you some guidance on some of the differences that some types of businesses have versus the others, some of the challenges and some of the potential controls. So let's break this down. Let me get my slide advanced. There we go. So let's start with areas that are generally self-enclosed. And these would be areas that would be large office spaces, manufacturing, warehousing, business-to-business services, call centers, spaces where generally you have some control over the interface between workers and others. But some of the challenges you're going to have in those spaces is people work together, they're friends, there could be some person-to-person contact because people are going to do what they do, which is be social. And so it's hard to break those habits and retrain to different behaviors. Some modular office spaces are very difficult to reconfigure or change the spacing. Break areas have to be addressed. If you have a large office space and a small break area and you have 500 people that are going on break and you only have a 500 square foot room to work with, they get very congested very quickly, and then people are eating so they don't have any face coverings on, and we have potential for spread. Restrooms have to be looked at to see if there's places that we can improve the distancing. The picture we saw earlier of the restroom with the the plexiglass panels in between the faucets, they couldn't re-engineer the faucets, so they put up a barrier to overcome that challenge of the spacing. We need to look at deliveries and outside visitors and how far we're going to allow them to come into our building. I know where I work, the UPS guy walks in the front door and he comes into our office space and we have a designated place for him that's inside the building. During this time, we've had to have them leave packages outside the door and say thank you and wave to them and have a nice day. So you have to look at some things like that where you're having people come into your building that you may or may not know, and you don't have any idea what their exposure, what their levels, any symptoms, because you're just meeting them for the first time. Another area in office buildings is the elevators, really small spaces with larger numbers of people and a lot of touch points. So those doors and the buttons and the walls and things like that need to be addressed. So some of the controls, we could try to redesign the workspaces. Maybe if we have a modular system, we can't change where the desks are. We might have to eliminate every other person to create the spacing and then reassign some of those people somewhere else. If we can't do that, maybe the physical barriers, the plexiglass or other types of physical barriers could be an option. Increasing that air circulation is going to help dissipate those aerosols. So if there's a way to increase more airflow into your space, that could be effective. A lot of businesses, as we know, have been working remotely, either completely or with staggered hours. Here at the Safety Council, we had a policy where we worked every other day, and we traded off. So half the staff was here on any given time, and the people that were here were distanced, and the rest of us were working from home. And we kept our front doors locked. We wouldn't let anybody in unless you had a real reason to be here. And along with those same lines, those controls are more frequent cleaning. And then, as Amber talked about, PPE that's scaled according to what your potential risk is. So let's go to retail, personal, maybe treatment services. These would be obviously retail stores. They could be salons, clinics, doctors, dentists, restaurants, physical therapy, body art. There's a lot of different things. And some of the challenges here is now you're much closer to other people, or you may have some direct contact because of the nature of your business. And in those areas, we also need to look at break rooms like we talked before, but checkout areas at a retail store, we're seeing a lot of distancing indicators. We're seeing plexiglass barriers. We're seeing no touch payment systems where I'm not taking my debit card and handing it to somebody or having to press a keypad that 50 other people just touched. Fitting rooms in retail stores are probably going to go away for a while. Restrooms, once again, we may have to do some engineering in the restrooms, or we may have to limit access to have fewer people at any given time. If you go to the doctor, waiting rooms are an issue, right? So some of the controls, controlled entry, if you have a retail business, you determine what your maximum capacity is to be. If you've gone to one of our favorite home improvement stores recently, you've noticed that there's a line outside the door almost all the time. That's because they've reached their capacity and they're controlling who goes in and who goes out. And there's somebody monitoring the exit, somebody monitoring the entry, and they're communicating. Once one person leaves, another one goes in. That's how they're maintaining their capacity. We're seeing a lot of signage and markings that, especially at checkout areas, 6 foot, either tape on the floor or stickers or something that's going to designate that 6 foot distancing. We have one-way aisles in some locations, physical barriers. Some retailers and other businesses are requiring all of their customers to wear a face covering if they come in. Some of the larger grocery chains and retail stores are requiring this. In some areas, let's say you're a dentist or a doctor and you're going to be very, very close or in contact with your patient, you might need eye protection. We talked about the mucous membranes of the eyes being one of the entry points, and we want to make sure that those are protected as well. I went to my doctor recently, and before I could enter the waiting room, they took my temperature. I had to fill out a form that stated that I hadn't been in any area where I've been, some of the countries that have higher levels, or I haven't been in direct contact with anybody. And then the other thing they did is once I'd signed in, they said, we're going to the exam room right now. We're not going to have you wait in the waiting room. We're going to take you back and eliminate you from any other people. Mobile direct services, this could be service companies that come to your business or your home, a plumber, electrician, landscapers, or it could be a direct service, for example, Uber or Lyft, or one of the ride shares, or a taxi cab. And the challenges here is we don't have a lot of control. If you show up, if I call a plumber out and he comes to my house, once he knocks on that door and I open it up, he has no idea what environment he's going into. He has no previous experience there. He doesn't know, there could be 20 sick people and he doesn't know it, right? And there could be a wide range of personal contact in these visits, and it's going to be much more difficult to prepare. So some potential controls, a wider range of PPE, different types of masks, different types of gloves, booties, gowns. You're just going to have more of a selection to choose from determined by what you observe when you get to that particular location. Delivery drivers would fall into these mobile services too. So once again, designate package delivery out on the front porch or outside the door, and not having direct contact with those drivers and those people delivering. Touchless payment systems, there's a lot of apps about sharing payments. So I no longer need to hand you my debit card. I can transfer it through my bank from my cell phone and take care of payment that way. If you're a rideshare or taxi cab driver, you might want to consider additional barriers in your vehicles between the front and back seat. You're driving along on a freeway and your person that you're giving the ride to sneezes in that enclosed space. What are you going to do? You need to think about these types of things. And then how do you disinfect in between the customers? Larger gathering places, these are going to be schools, churches, larger healthcare facilities, mass transit like trains and airplanes, movie theaters, hospitality, convention, sports arenas. The challenge, lots of people in close contact for extended periods of time. It's really difficult to control their movement. There's going to be lines for tickets, lines for security, lines for entry, lines for restrooms, lines for service areas, food service. So how do we deal with that? Well, we may have to reduce the capacity. We have a directive from Governor Ducey that says sports arenas can open up, but initially without fans, right? And once we do start introducing fans and more people to these spaces, we're going to have to come up with ways to help control their movements and maintain this spacing. We might have to change the seating configuration, lots of signage, lots of markings, lots of physical barriers. And once again, there may be a requirement, just like there are on airplanes right now, that everybody has to wear a mask before they get on the airplane. And along these same lines, much more frequent cleaning and more thorough cleaning. You imagine an airplane, they would turn in those flights around in 20, 30 minutes. And now it's going to take a lot more time to do a much more thorough disinfecting of that plane before they can fly. So it's going to affect how quickly the airlines can turn those planes around. And then construction sites, challenges, lots of different conditions, lots of tasks. You might have one forklift and 10 guys that have to use it, right? So in the past, one guy would jump on, jump off, and nobody worried about it. But now we have to think about, let's disinfect that piece of equipment before we share it. Portable restrooms. These are generally serviced by the company that they're providing, but they don't usually come every daily to clean those. So we have to come up with plans. Job trailers are smaller spaces and everybody takes their PPE off when they get inside. And some of the HVAC may not be operable in a building that's under construction. So some potential controls, stagger work times, limit sharing of tools, additional PPE, but keep in mind if we add more PPE, don't create additional hazards that might come into play. Those portable restrooms, we're gonna have to make a plan to disinfect those multiple times during the day now, so especially the touch points, the door handles, the sinks, the surfaces, other surfaces that you're in contact with. Stagger break times or designate additional break areas, and then install fans for more circulation. So we're going to go to some procedures before we return, and this is where you get Amber back again. So Amber, take it away.
All right, there we go. Thank you, Ed. So hopefully we've given you kind of some good recommendations, specific and not specific to your, to your industry, again, following that hierarchy of controls. But regardless of where you stand with that, I want you to take a look at what to do before the workers return. I realize some of us were essential and already had our doors open. Regardless of that, we've got to think about even when employees are staggered. So if you've got employees that are working at home a few days a week, or vice versa, they're working full-time from home and then coming back to the office to maybe drop off paperwork, in your programs, think about what to do before they return. Are you going to include additional screening measures, maybe some questionnaires? I've seen a lot of good questionnaires of stop, think, have you been exposed to this, and this, a bunch bunch of yes or no questions. If they answer yes, having procedures in place on what to do. Medical histories, temperature checks, COVID-19 testing, while those can be good measures in place, I do want to talk about, you want to contact your human resources department or maybe even your corporate attorneys with that stuff, because there might be some implications. You're going to have things like the anti-discrimination and HIPAA laws. So temperature screenings too, that can be a challenge. It's hard to get the resources. Another thing that's a reactive measure, so can be good, but you want to ask yourself before jumping to something like that, are the logistics? Are you going to have people backing? What I've seen is, everybody shows up at 8 o'clock and now I've got a line of 10 people waiting to get their temperatures screened, and now they're not following the social distancing. So look at these things all the way through before you implement these measures. That link is a very good, dry but very good webinar from the EEOC that talks about some of the implications, some of the good, and maybe some of the things you need to factor when putting in these before these screening measures. All right, next slide. Thank you. So before I pass it to Ed and we open it up for questions, I wanted to talk about establishing that new norm. I often get people that are frustrated with Amber. I just, I don't want to talk about the new norm. Well, we have to, regardless of how this has affected us. Whether you've remained open, whether, again, we've had full closures, partial closures, we have to talk about, we do have new things in place. We've got a new program in place. So I want to encourage you to develop a return to work orientation program. Again, going back to that fear, that noise, a lot of your workforce, they're getting information somewhere. So in order to get that buy-in, in order to get a smooth transition into this, get them involved. OSHA often requires that we have a new hire orientation in regards to the safety hazards, but let's have a return to work orientation program. This is your opportunity to thoroughly communicate, what are you doing, so that we get rid of that fear, get them engaged, give them the information, provide them the training on the controls, what you've chosen, why you've chosen. If you've gone to certain PPE, use this as the time to educate them on how to wear it. I also want to recommend, be supportive and communicate with them. We have no idea what your workforce has been facing. A lot of people might have been facing financial stresses if you were closed the whole time, or maybe a reduction in hours. Maybe they were assisting, sick family. We had total closures of daycare. We have no idea the effects, the mental stresses, the anxieties, the fear that your workforce has been facing. So when you're putting your program together, I encourage you to make accommodations for that. Again, talk to them about the positive changes, what you're doing, and then take this all the way through. Continue to talk to them throughout, whether you're phasing in or it's just a complete open. Communicate with your workforce. If you want to see those effective changes, absolutely communicate. And then lastly, have a backup plan. Contingency plans are key. As these restrictions are lifted, we have no idea if we're going to see a spike or a decrease in disease rates, but we have to have a plan. A failure to plan is planning to fail. This isn't the first pandemic that we've seen. It's not going to be the last. We have no idea if we're going to see another shutdown. So when you're putting this together, let's talk about it. Just like we've got to have a plan if what to do. Hey, Amber, if OSHA shows up, oh no, what do I do? Same thing here. What are we going to do if something else happens? So include that in your programs. I'm going to hand it over to Ed, who's going to finish us up with what's going on in Arizona, and then we'll open it up to some Q&A.
Thanks, Amber. Great job. So yeah, currently where we are in Arizona is that the stay at home, stay healthy, stay connected order expires tomorrow. And then we have some progressive openings that have already taken place. Now let's reinforce the fact that all these are subject to following CDC, Arizona Department of Health Services, and Governor Ducey's guidelines that are contained in these executive orders. So May 1st, elective surgeries could take place. May 4th, we had some non-essential retailers that were open on a limited basis through delivery, walk-up, curbside, or appointment only. On the 8th, non-essential retailers could open fully with distancing and other things in place, as well as barbers and cosmetologists. May 11th, which was Monday, we had Restaurants were able to offer in-place dining. Yesterday, pools and gyms could reopen. On the 15th, Major League Sports limited reopenings without fans. And on Saturday, movie theaters could open. So we're going through kind of a gradual phase in of these easing of restrictions. And it's important to stay up on what these are. This brings up to our Q&A. The picture that's on the screen is from the 1918 pandemic from the Spanish flu, which killed 50 million people worldwide. And it's a low resolution picture, but the sign that the lady on the edge is wearing says, wear a mask or go to jail. That's pretty extreme situation. We're not quite there yet with this pandemic, and hope we never are, but that just shows the severity of what was happening back at that time. So we will start to entertain questions, and while we're doing it, I'll put up a slide with various links on there. And there was a question as whether or not you get this presentation. We're working on making that happen. So my short answer is yes, we should be able to send you a copy of this presentation as well as a recording. But you can see all the governor's executive orders and CDC, OSHA, EPA, World Health, Arizona Department of Health Services, National Safety Council. And we also have a link if anybody's looking for a local lab to do some testing. They're one that we've had some contact with that we feel that they are very legitimate. So at this point, let's take some questions if you don't mind.
Thank you, Ed. Thank you, Amber. A few quick responses to that. There was a question about how they can get in touch with you. So I'll just direct everyone to the bottom of that slide. You've got Amber and Ed's email addresses and phone numbers there. So if you're looking for how to get in touch with them, the information is there. And then the other question about will this be made available? Yes, I'm posting in our chat box website to our Small Business Bootcamp webpage. We record all of these sessions and post the materials from the session. So shortly after this wraps up, we'll have the webinar recording as well as this presentation on that website. You can also go and view any past webinars and register for next week's as well. So I encourage you to check that out. Amber, I know there was a question in the Q&A that you wanted to answer live.
Yeah. So I believe the question was, if we're currently working from home, can we mandate our employees to return to working in the office? So this is a touchy one. While I'm going to recommend that you refer to HR, and if you've got any corporate counsel, refer to them. But simply put, just for time, you cannot force your employees to come to work. However, if you've put everything in place, you've developed your return to work program, you've done everything that you can to kind of ease that fear, because that's what I found. A lot of people aren't wanting to return to work due to fear. There's a lot of unknowns. So you've put your program, you've implemented, your engineering controls, you've got everything, you've got training available. You do have the option of communicating what you've done to your workforce, giving them what's available to them to come to work. And if they choose not to come to work, then that is on their own. And you do have the ability to hire other people in that. So that's where it does get a little touchy. I'm obviously not an attorney. I have owned my own business for quite some years. So I do know a little bit about this, but definitely refer to HR. But you cannot force them to work, but you can offer them work. I hope that answers that one.
Thanks. And Amber, while I have you, could you answer live the question earlier about the requirements for even low-risk businesses to have an emergency preparedness plan?
Yeah, so thank you. I wanted to separate. So there's actually quite a few regulations on written plans. So I want to just throw that out there. It's not just this one, but an emergency action plan is a little bit different than a disease preparedness plan, but some employers include them together. And that's why that question kind of got wrapped in. Emergency action plans, OSHA does require, if you've got fire extinguishers or, they're provided anywhere, and at any one point, your employees are going to be required to evacuate, you have to have a plan regardless on what you face. There are some exemptions as far as whether that plan has to be written or orally communicated. That's dependent on size, but it's not risk. So that has nothing to do with it. I have not run into an employer yet that has not met that exception, unless you have a fire brigade. If you've got a fire brigade, but I haven't seen too many of that. Again, I don't know everything, but if you've got that, there's some exemptions. So yes, I'm going to just put out out there. You got to have an emergency action plan, but more so that disease prevention plan. OSHA doesn't necessarily say anything, but I want to talk a little bit about good faith, because I was out with OSHA again all day yesterday, and every single place it was, what efforts and what have you put in place as an employer to show good faith that you are trying to comply with that general duty clause, that you as the employer are trying to protect your workers, you're trying to prevent the spread of this disease. What are you doing? That is where having that written plan is key. There's a OSHA, their website, they've got a lot of excellent information. There's some templates out there. It doesn't need to be elaborate. I know a lot of people that I work with, you know, it's nerve-wracking. Where do I start? Does it have to be 10 pages? No, you can have something simple. I've seen something simple as 1 page. It just depends on your workforce, your exposure, but I absolutely recommend having something written, because that's going to demonstrate to OSHA that good faith effort. So again, emergency action plan is a little bit different. I want to say, yes, most of you have got to have it. This disease, the prevention preparedness plans, I'm going to recommend it. Yes, have something written down. But if you feel confident not having something written and OSHA were to walk into your doors and you can show them, hey, we've got good faith, we've got this and this, without it, all the power to you. But starting with a written one is going to be my best recommendation.
Thanks, Amber. Thanks, Ed. I just wanted to be respectful of your time. We're at the hour, so I wanted to thank both of our speakers today. We will be having another safety session next Thursday. Ed or Amber will be back to continue presenting on these important safety topics. So we're grateful to have your partnership and just two really great sessions today. And so thank you very much. For everyone on the line, we've got our marketing panel tomorrow. Please join us. Go ahead and register. We're going to have some experts on the line and have a lot of great discussion around how to jumpstart our marketing plans. Other than that, thank you to everyone, and I hope you have a great rest of your day.
Thank you.
Thank you very much, and we appreciate you allowing us to be a part of your day.